Hello, and welcome to the Permission to Breathe podcast, a transformative space dedicated to providing a sanctuary where you can inhale deeply and exhale freely, embracing your grief journey unapologetically. I am your host, Dr. Tammy Isaac, here with you every Monday to offer comfort, guidance, and hope. Together we'll navigate this path, finding moments to pause, reflect, and breathe. Let's begin this journey side by side. Today's episode of Permission to Breathe is sponsored by Aurora's Grief Journey, my new children's book about navigating loss and finding comfort. Aurora's Grief Journey follows a young girl who's learning to cope with the loss of her grandfather. Through heartfelt storytelling and faithful activities, the book helps children understand their feelings and provides families with practical ways to heal together. If you're looking for a gentle resource to support a child through grief, this book is the perfect place to start. You can grab your copy today on Amazon. Thank you for tuning in. Now let's continue this journey of healing together. Today's episode will explore what grief looks like for those with breast cancer. It delves into the emotional, physical, and mental toll breast cancer takes on patients, highlighting the many forms of grief they experience throughout their journey. From the grief of losing control over their bodies and future to the sorrow associated with physical changes and identity loss. This episode addresses the often invisible emotional struggle that accompany the disease. It will also touch on anticipatory grief for those facing terminal diagnosis and the grief of relationships that are affected by cancer. Through compassionate insights, this episode provides an understanding of these grief experiences and offers guidance on how caregivers and loved ones can provide support. Listeners are reminded that grief is valid, deeply personal, and that it's okay to grieve while navigating the challenging realities of breast cancer. So let's take a deep breath and let's begin the healing journey. Breast cancer is not just a physical journey, but it's also emotional, spiritual, and mental. So for those diagnosed with breast cancer, grief often becomes an unwelcome companion. Grieving the loss of control is one of the most profound and often overlooked aspects of breast cancer. For many, a breast cancer diagnosis marks a sudden shift in life where what was certain or predictable of a day-to-day living are now replaced with medical appointments, treatments, and the unknown of how the disease will progress. So when we think about the sudden shift to uncertainty, you think about how before a diagnosis, we often move through life with an underlying sense of predictability, and we make plans for the future. We feel confident in the health of our bodies, and we trust that we have control over our daily routines. But a breast cancer diagnosis disrupts this normalcy instantly. Suddenly, what was once taken for granted, our health, our energy, our future, feels fragile. And the plans that we've made for months or even years are put on hold or upended entirely. You know, this sudden shift from certainty to uncertainty can be very jarring. And life becomes filled with what ifs. What will the treatment look like? Will the cancer respond to therapy? How will the side effects affect daily life? Will life ever go back to what it was before? For some, this uncertainty triggers anxiety and a deep sense of fear. For others, it can also lead to feelings of powerlessness because now you're not in control of what you thought that you once were in control of. Breast cancer not only affects the present, but also throws the future into uncertainty. Many patients experience grief over the loss of the future they once envisioned for themselves. Many patients have plans for their career advancement, family life, or even travel and personal goals that now seem delayed or potentially forever lost. This is where the grief of loss, control over future plans become particularly poignant. For some, there's the grief of not knowing where they will be able to continue. Whether they will be able to continue working, will they be able to fulfill personal dreams or live out milestones they once took for granted? And breast cancer forces a type of reckoning with mortality and the unpredictability of life, which can deeply affect one's sense of security and hope for the future. With treatment plans, medical appointments, and physical limitations often dictating what's possible, many people with breast cancer can grieve the loss of their old routines and independence. Things that once felt normal, like going to work, exercising, or even taking care of one's family, may no longer be possible or may come with new difficulties. This loss of independence can feel especially acute for those who were once the caretaker or the strong figures in the family. Now the roles may reverse and they may find themselves relying on others for support. And this role reversal can bring about feelings of guilt or frustration, adding another layer of grief as they navigate these new dynamics. Now, this is especially true when you see parents become ill or even grow old, and now the child has to step in as the so-called parent or adult to now caring for the parent as if they are the child, right? This reversal in roles start to happen. And a lot of times parents find it very difficult to lean on their children for support, especially when they have displayed for their family and children as being the strong one in the family, the one who has always done everything, always pulled everybody together, always worked things out, always had a solution, who took things better or than most people would, right? In my family, that of course was my mother, right? So she was the one who was always navigating everybody's journey of challenge and a journey of weakness and being the strength of holding us all together. So when she was diagnosed with cancer and had to go through surgery and chemo and radiation, of course, this made her physically weak and she was not able to do the things that she normally would. And so the dependency that she had to display, I know, was very difficult for her. And when she had cancer, she and I lived together. So that meant that I had to do a lot of things for her, as far as cook her breakfast, make sure she got the things that she needed, or even just letting her know what was most important for her at that time. Because a lot of times you could be very weak and very sick and not wanting to eat, not wanting to do certain things. And so having, I think I was in my 20s and, or barely in my 20s, when she had cancer. So, listening to your baby daughter give direction could be very difficult. And so that loss of independence is a real struggle. And then also just the loss of routine. The thing about routines, people don't realize that there's a safety that is found in routine. And I am really understanding that a lot more as I have grown older, because just the nighttime routines that I have and the morning routines that I have, I realize that they bring some type of a comfort and security to me, that I know that this is the way things are going to go, and this is the way that I'm used to doing it, and I know what it's going to look like after I've done it, and I know what that does for me. to be able to have these routines. And it's a sense of control that we tend to have or need in life, because the human, as humans, we have this innate need to control certain things, to have a barrier around what's happening to us. And when we don't, it becomes difficult, it becomes frustrating and hard to navigate through those moments. So when we think about this role reversal with the parent and child, they can become, the parent can be feel frustrated and even guilty for having to lean on your children. And a lot of time, and me working in the hospital, working in hospice as well as a chaplain, and having conversations with parents and older generation that are maybe living with their children and having to depend on them more often, or even if they're living in their own home and their children have to come by and check on them. A lot of the topic is, I just don't want to disrupt their life. I know they have their own life, they have their own family, they have their own kids. And so there is this burden that they feel like they're putting on their children. And sometimes that may be real, and sometimes it's just imaginative, because they feel like I'm the parent and I should always be in control and take things and deal with things as they flow. But one of the things I learned in loving my mom and my dad as they went through their sickness to death was, though those moments were very difficult and very hard and taxing to my mental, physical, and spiritual self, as I look now, I would do it all over again because I love them. And those were the last moments that I was able to spend with them that I will cherish for the rest of my life. And though it was hard to do and to watch, I would not trade those moments for anything. And so I try to encourage patients, older patients, and let them know that, as children, we find these moments very precious, and we cherish these moments to be able to care for them because we know that they won't be here one day. When someone is diagnosed with breast cancer, they often face not only the emotional and mental toll of the disease, but they also experience the physical changes that come with treatment. So this can result in a profound grief over the loss of physical autonomy, as the body, once familiar and reliable, becomes a battleground for survival. So let's talk a little bit about understanding our body grief. Body grief is the emotional and psychological response to the physical changes that's caused by breast cancer and its treatments. It's a form of mourning that reflects the loss of how the body once functioned and appeared. So this grief isn't just about appearances. It's about the identity, the sexuality, health, and independence, all of which can feel compromised by the effects of the disease and its treatment. For many, the body is closely tied to their sense of self. People are identified by their bodies. And when the body undergoes dramatic changes, whether through surgery like the mastectomy, whether it's the hair loss from chemo or weight fluctuation, it can feel like a loss of identity. And the person looking back in the mirror might seem like a stranger to them, causing this disconnect between who they feel they are and who they now see in the mirror. So one of the most significant sources of body grief in breast cancer patients comes from surgeries such as the lumpectomy and the mastectomy. So these procedures, while they are life-saving, They involve the removal of part or all of the breast tissue, which is an intimate part of the body that is often tied to femininity, sexuality, and body image. So when my mom went through breast cancer, she had a partial mastectomy. So she lost a portion of her breast. And for many women, breasts are not just physical features, but symbols, man, of womanhood. It's a symbol of motherhood and identity. These are the things that identify us as women. And the loss of one or both breasts can bring, or even a piece of the breast, can bring on intense feelings of sadness, shame, or embarrassment, even when they know the surgery is necessary for survival. It's like losing a piece of who you are as a woman. Now, reconstruction surgery can sometimes mitigate these feelings, but the emotional grief of losing a part of oneself often will linger long after the physical healing is complete. So that's something that we have to be aware of. I can go through reconstructive surgery, which will, help me a little bit emotionally and mentally, but I still realize that there is an original piece of me that is taking away. And it takes time to be able to grieve through that in order to get to a place where you feel whole again. So even if someone opts for or is able to have reconstructive surgery, the new body may still feel different. And the scars, both physical and emotional, can serve as constant reminders of what has been lost. And some women may feel discomfort in intimacy as they navigate the new reality of their bodies in personal relationships. So even, with your mate, with your spouse, it can make it very hard to want to have sex and to engage in intimacy with your loved one, because you don't feel sexy. You don't feel like a woman. You don't feel beautiful, right? You don't feel your womanhood or your femininity, right? And so it takes time to navigate that place and that journey into this new reality of what my body looks like, and to engage with this new body that I have with myself, and then also to be able to engage this new body that I have with my partner. It is doable, but it definitely takes time, and it takes a sacred space and people who will journey with you. And this is very important for those who have spouses and partners when it comes to the sexuality part and being intimate. Is you want to make sure that you have a partner and a spouse who is gentle with you, that has grace to help you through that journey and help you to recognize that it's okay, and that they are, just patient enough to help you go through that journey, and you don't go by yourself, so that you both can get to a space of intimacy, and that you can enjoy the new body that you have, and that they too can also enjoy that body as well, and you enjoy it together. Hair loss is another visible change that can contribute to body grief. For many, hair represents beauty, vitality, and a sense of normalcy. Hair for a woman is her glory, right? So losing hair to chemotherapy can feel like an outward sign of illness, a visible marker that something is wrong. It can cause people to feel vulnerable and exposed, especially when it elicits comments or stares from other people. Hair loss can also impact how patients see themselves. Some may no longer feel attractive or feminine, which can affect our self-esteem and our confidence, right? Our hair is a big part of how we present ourselves. For some, it's the shock of not recognizing themselves in the mirror anymore when their hair falls out. Like, who am I? because there are parts of us that we identify ourselves with. And when that part is missing, we no longer recognize or identify ourselves and believe that nobody will be able to receive us in this different way because we look different. Because believe it or not, we do in some aspect present ourselves in a way that not just bring us joy and happiness, but also we do a lot of presenting ourselves to please and get comments and remarks from other people. And so that's a big thing that we deal with, or that you will have to deal with when you are diagnosed with breast cancer and going through chemo and radiation, that the hair will fall out. And a lot of people experience this as a very tragic or traumatic moment, that really takes some time to really talk yourself through. And you've seen a lot of videos, social media, where people are actually going ahead and cutting their hair off because they realize that it's slowly coming out. But a lot of people hold on to it as long as they can. You see people talk themselves through it. They cry as they go through it. They have family supporting them, around them, going through it as well. That's why you have seen many people, husbands, wives, daughters, friends, also cut their hair in solidarity with the patient, so that they don't feel alone and don't find themselves isolating themselves, because they don't want to be in the presence of anybody to see them without their hair. As they look in the mirror and start reflecting back at themselves, it just doesn't tend to match who that they feel they are on the inside, which leads them to discomfort with their self-image and this external appearance. Now, these visible changes can also lead to feelings of isolation and embarrassment, is what I just said, which some patients start to withdraw from social interactions to avoid uncomfortable questions, or like the pity remarks that some unwise, unintelligent people will make, which can make you feel sad. In addition to outward appearance, breast cancer treatments can also affect how the body functions on a daily basis. So when we think about chemotherapy, radiation, and other treatments, they can leave patients feeling physically weak, fatigued, and unable to engage in activities they once enjoyed. So the loss of their physical strength and stamina can be incredibly frustrating and disheartening, especially for those who once took pride in their physical abilities. Today we did a bra event for our breast cancer survivors at the hospital, and there was a woman who came in who sat down. She wasn't talking to anybody. She wasn't really fellowshipping. You know, she got a little snacks, she got a bag, and she was just sitting there, and she looked a little down and distressed. So I went over and I remembered her name when she signed in, and I just started talking to her, and she mentioned to me that she had just come from radiation. She was feeling very tired, and, she was a little disappointed because she wanted to wash her hair and she wanted to put on makeup so that she can come to the event. And she said, but I'm just too tired. And then she was explaining, like, she still works, right? And she still has a training that she needs to go through. And so she was very just frustrated and disheartened that the things that she once could do and be capable of, that it takes almost a whole event just to be able to accomplish daily activities. She was mentioning that, one day she can have full of energy, and then she's going to bed saying what she's going to do the next day, and wake up and can't do any of it because she's just completely exhausted. Now, this type of body grief can be about more than just appearance. It is also about grieving the loss of the body's capabilities. And so that's what I was talking about with the lady that I met today. Like simple activities like going for a walk, carrying groceries, or playing with children might suddenly feel exhausting. And the frustration of not being able to trust the body to perform as it once did can lead to feelings of inadequacy or defeat. And many patients experience a sense of betrayal as though the body has turned against them. And, when I was talking to the lady, she just mentioned, I really wasn't going to do that much. I was going to cook some food. I was going to clean the bathroom. And she mentioned something else that she was going to do. She said it really wasn't that much that I was going to do. It was just like a normal Saturday, but I just could not do it. And she struggled with, the mind telling her, okay, these are the things I'm going to do. But the body is saying, no, you're not going to do that. Are you grieving and feel like you're struggling alone? You don't have to walk this path by yourself. Book a virtual session with Dr. Tammy Isaac at Breathe Grief Counseling Center. Visit us online at www.breathegriefcounselingcenter.com. Dr. Isaac will help you put your emotions into words. She'll help you reduce the feeling of isolation. She'll help you understand that everyone grieves differently and also help you prevent unhealthy coping mechanisms. Take control of your life with world-class counseling sessions today with Dr. Tammy Isaac. The medicalization of the body during breast cancer treatment can also lead to feelings of loss of control of your physical self. The constant medical appointments, treatments, and tests can make it feel like your body is no longer your own. Instead, it becomes an object to be managed, to be prodded and altered by doctors and medical professionals. This loss of bodily autonomy can create a sense of disempowerment where patients feel like they are no longer in control of their own bodies. The side effects of treatments, from nausea to fatigue to physical changes, it can all make it hard to feel like your body even belongs to you anymore. It's as though the body is now controlled by the cancer and the treatments rather than the person living in it. But there are ways that we can cope with body grief. Navigating body grief is a process, but there are ways to support healing and self-acceptance. So the first way is to acknowledge the grief. That's the first step. The first step is coping and with your grief by recognizing and validating it, knowing that it's okay to feel sad or frustrated about the changes that your body is going through. Acknowledge this grief and allow it to be a part of your healing process as you learn to cope, and it'll help it make it just a little bit easier. It'll still be hard, but you can get through it. The second thing is redefine beauty and strength. So society imposes on us this narrow definition of beauty and strength, but healing involves redefining those terms for ourselves, because beauty is not limited to physical appearance and strength isn't only about physical capabilities. Celebrate the resilience of your body and the fact that it's fighting to heal you. Celebrate the fact that your body, a friend of mine mentioned this. She's a holistic and wellness coach. And I heard her do a talk and she was saying, her name is Lashana Moore. Her podcast is Holistically Speaking. And she said that we need to appreciate our bodies because our bodies have been carrying us for all of our lives, right? So however old you are, right? It's been supporting you. It's been keeping you and allowing you to navigate this journey of life. And then when it gets sick, we've been taking it for granted for so long. When we get sick, we become disappointed in the body, but actually our bodies are doing its very best to fight for us so that we can get to a place of healing. And it's been doing that all the days of our life. It's just that we've come to a point where we have a very difficult illness that needs a little more strength and power to be able to heal. But the body is resilient and it is doing its best to heal us. And so we need to learn to appreciate our bodies. The third thing is seek support. I'm a big proponent about finding communities that can support you, that can encourage you along the way. So whether that is through a support group, counseling, or simply just talking to a loved one, sharing the emotional impact of body grief can often lighten the load, because now you're sharing that and you're not just carrying that weight, but you're releasing it into out of you into the atmosphere so that somebody else can help you carry that load. And it can be really helpful to connect with others who've actually experienced that similar feeling, and who actually understand the complexity of grieving physical changes. So one of the things that I helped my mom was that she was a part of several different breast cancer survivor groups, which helped her be able to engage with other people who experienced, who did experience, who was experiencing these types of emotions, and that you can find a type of identifying with somebody else who have actually experienced that, or was going through it at the moment, to stand together because now you both understand the experience that is happening. Um, 4, practice self-compassion. I say be graceful to yourself. Show yourself some grace. Be gentle with yourself as you navigate this grief. It's natural to feel frustrated or even upset, but you've got to learn to practice self-compassion because it can help ease the emotional burden. So you want to try to avoid judging yourself for how you feel or even comparing your journey to somebody else, because what you feel is not necessarily the same thing that others will feel. What you're able to do is not necessarily something somebody else is able to do. Our bodies are very different. We may have same diseases, but our body functions are very different, and how it combats or deals with the disease that we're going through. So it's important. You hear doctors all the time, listen to your body, because our minds will tell us that we can do certain things, but our body is also telling us now it's not the time. And so we want to practice some self-compassion with ourselves and recognize what we're able to do at this time and what we're maybe not able to do at this time. 5, you want to explore new forms of intimacy. So for those that are struggling with changes in their intimacy, you want to open communication with your partner is going to be key. You want to explore new ways so that you guys can connect, whether emotionally or physically. It can help rebuild the closeness and create a sense of shared healing. So I think it's important that when you have a spouse or a mate and you're going through this, that you go through it together, and that you provide grace to yourself and to the partner as you both go through it, because you're both experiencing it from different perspectives, and you want to be supportive and help each other through it, and identify and recognize that you both will grieve in different ways, and you want to support each person as they go through their grief in whatever way that may look like. But in order for that to work and happen, you must have open communication to express exactly how you feel and what you're experiencing at that moment. And then also reaffirming your love, your kindness, and your support for them as they go through that process. And the number 6, you want to focus on what you can control. We've talked a lot about like what we can't control, losing control, this uncertainty, no more predictability, but there are some things that we can't control. So while breast cancer treatment may feel like it takes control away, us focusing on small things that you can control can help restore a sense of agency for you. So whether it's choosing to wear a certain piece of clothing or practicing daily self-care, these small actions are very important and can make a big difference in feeling like you've lost all control, to helping you identify that there are some areas in your life that you still do have control over. And so you want to make sure that you're using the control in the places that you are able to use them. So let's talk about how we as caregivers, friends, and loved ones can support someone going through breast cancer and grief. Supporting someone grieving breast cancer really requires compassion and empathy and a deep understanding that their grief may be multifaceted. So whether they are grieving their diagnosis, physical changes, the loss of independence, or the fear of the future, they need ongoing emotional support. And here are a few ways that we can effectively provide that support for them. So the first one is we want to just simply acknowledge the grief. We want to acknowledge their grief so that they know that their grief is real and also valid. Grief during breast cancer can be complex And it's not just about the possibility of their death, but also it's about the physical and the emotional losses that they're experiencing all at the same time, right? So we want to let them know that we hear them, that we see them, and we acknowledge and validate what they're feeling. Two is to be present and to listen actively. So, breast cancer can make a person feel isolated even when they are surrounded by a whole lot of other people, family, and have a lot of support. But sometimes what they need most in someone is someone who will be there, ready to listen without offering solutions or advice. And also, too, it is why feeling isolated is so prominent is because a lot of times they are feeling like though you're there with them for support, you really don't understand or feel or experience what they're going through at the moment. So they feel isolated because it is only them that's going through it. And that's why I think it's very important to make sure that if you're grieving and going through breast cancer, it's important to have support groups with other people who also identify with you in that experience so you don't feel so isolated. So when you get to these moments where your support team who doesn't know that experience, you're not putting so much of a heavy weight on them to not feel isolated, but just to enjoy their presence and to allow them just to listen, even if they can't identify at that moment. So you want to make sure that you are surrounded by people who love you and that are just ready to listen, that active listening and not coming trying to give advice or solutions, but just really hearing them out. The third thing is sometimes we can offer some practical help. So breast cancer treatment can be physically draining and many patients need help, with everyday tasks. So sometimes offering practical support like alleviating some of the stress and allow them to focus on their health and healing. So if there's some housework that needs to be done, some phone calls that need to be made, errands, some grocery shopping or things like that, tending to family or little children, listen, you could really offer that practical help that can be so important and helpful to them versus trying to give solutions or advice, right? Number four, respect their boundaries. So each person's journey with breast cancer is different, and it's important to respect their emotion and physical boundaries. So some days they may want to talk about what they're going through, while other days they may want to focus on anything but cancer. And also, too, it's important to remember that a lot of the control of circumstance and situations now are out of their control. They feel like they have no control around that. They've lost a lot of, independence and a lot of, establishing, their thoughts and what they want to do for the day. Everything is basically based off of their medical journey, their appointments and things like that. And so there are some areas of boundaries that have to be crossed and has been so that they can make sure they get the treatment and the support that they need. They don't need loved ones who are there to support them, to force them to cross boundaries and also lose control over just having a conversation or being present with people that they love. So, respect the fact that whether they want to talk about it that day or not, whether they want to focus on that or not. I think you can identify times when they're probably in denial, but a lot of times it's not denial. It's just, I'd rather pay attention to something else today. I'd rather be focused on something else that'll bring me some sunshine and joy. They're thinking about their health day in and day out, right? Especially when you're going through treatment, you can't help but to think about it, especially when your body is weak and you can't get up that particular day. So we just want to make sure that we respect their boundaries and what they're able and willing to do that day. Number 5, encourage them to express their emotions. One of the most important ways to support someone grieving breast cancer is to create a space where they feel safe expressing their emotions. So allow them to cry, to get angry, or to vent their frustrations without the fear of judgment. That's one of the main focuses on creating a safe space. One of the things you're doing in that space is being an active listener, which I'm not giving advice or solutions, nor am I judging, right? I am allowing them to experience and to explore all of the emotions that they have going on within them, and allowing them to do that in a space where they know that they are safe and that they can trust me to do that, so that they don't have any fear of you judging them after they leave there and who you're going to tell of what happened, of what they've done or what they've said, you know. So it's important that they feel safe in that sacred space, and that you encourage them to be able to do that. Number 6, support their body image and physical changes. So as breast cancer often brings changes to the body, many patients and our loved ones will experience a form of body grief. We talked about that a little bit earlier. So we want to support their journey by offering compassion and reassurance, especially around body image and physical appearance. So you want to be careful of what you say and what you recognize that is happening about it. We have a bad habit, and I'm not going to say everybody, but a bad habit of when you see somebody and you see that there's a drastic change, you'd be like, oh, you really gained weight. And you don't really understand why that person has gained weight. Or, oh, congratulations, you're pregnant, and that person is not pregnant. Or even, oh, you lost a lot of weight, you look sick. Like, you have to be careful on the language that you're using towards people's physical body and appearances, because we don't know what's happening with them, especially when you know that this person is going through an illness. You want to be careful and make sure that your words are full of compassion and reassurance of how they look. And even if they express something about their body, we want to still respond with compassion and reassurance and not feed into the negative bent of the way that they look. 7, help maintain a sense of normalcy if that is possible. So breast cancer can take over a person's life, but finding moments of normalcy can provide relief from the constant focus of the illness. So I think too, when we are respecting their boundaries, they are, and we are also trying to put in play a bit of normalcy to their life, right? Because everything is kind of topsy-turvy, right? Everything is up in the air. Everything is based on the cancer, based on medical advice, based on treatments. And so it is far from normal at this point. But when we respect their boundaries, this is us helping them and allowing them to regain a sense of normalcy in their life. So we want to make sure that we can support them in those moments where they're not constantly always focusing on the illness, which could lead to depression, right? But we want to help them engage in activities that also brings joy and a sense of a normal life. So if there are some things that that they've enjoyed before in the past, and that they are able to do those things while going through their treatment, and their body gives them the capacity to do whatever that is, then you can encourage them to be able to do that. And you can encourage their family to support them in those things too. And even you could find new ways of doing things as well that they may find joy and pleasure in doing during that time. 8, encourage professional support when needed. Sometimes the emotional toll of breast cancer is extremely heavy, and too heavy really to bear alone. So if you sense that your loved one is struggling deeply with grief, depression, or anxiety, just gently encourage them to seek professional help from a counselor or a therapist. And you want to be very careful with the language that you use and how you offer that as a support for them. You want to make sure that you're doing it at the right time, at the right moment. You want to make sure that you are the person that they will listen to and take that kind of advice from. So not everybody has the ability or the capacity to be able to encourage people to have some professional support. That it can be a very touchy subject, dealing with different cultures and backgrounds. And so you want to make sure that if you're encouraging this type of support, that you are the type of person that they will take this information from and really honor what you're sharing with them. And the last thing I want to share is that be there for the long haul. The journey through breast cancer can be extremely long and hard with many, many, many ups and downs. So supporting someone through this grief means that you're being there, not just in the immediate aftermath of the diagnosis or the treatment, but for the long haul and the road ahead. So that means you want to be invested in the time that you have with them through the whole journey of the process. And you want to be there for a big chunk of that, and being there in some most valuable and opportune moments to make sure that it's a significant time that you are with them. They're going to need as much support as they can get going through this journey. And even afterwards, there's a lot that they will experience and a lot of other health challenges that they could possibly also experience. I just wrote an article in the Facts newspaper in Brazoria County titled Heart. I can't remember the title at this point, but it just says that the breast cancer survivors, the next fight is heart disease, because my mom, though she survived cancer for 14 years, her treatment of chemo and radiation really affected her heart, which led her to congestive heart failure, which was something else that she ended up having to experience years later, that we also had to walk with her in that journey. And so we just never know where the road is going to lead after the diagnosis. And so you want to make sure that you can be supportive as long as you can on the road with them, because they're going to need it day in and day out. Breast cancer doesn't just affect the person diagnosed, it ripples out to their loved ones. And there's a unique grief that comes with facing a diagnosis, whether it's anticipatory grief, grieving changes in identity, or mourning the physical losses along the way. Even caregivers can experience their own grief as they watch someone they love suffer and feel helpless at times. Grief is a natural response to loss, but it's also incredibly personal. And there's no one right way to grieve. So if you or someone you love is walking through breast cancer and is accompanying grief, I encourage you to give yourself permission to feel what you're feeling. And one thing I often suggest is taking time to breathe slowly, intentionally, and allowing yourself to be present in your emotions. Journaling or prayer can also be, powerful ways to process the grief. And if you need to, please don't hesitate to reach out to support groups and or counselors who can definitely guide you through the process. Breast cancer may change us, but it doesn't take away our ability to love, to hope, to find meaning in the midst of the hardest moments of our lives. Grief is something we carry with us, but we don't have to carry it alone. So I want to encourage you today to breathe, to take one step at a time, and to know that you are supported on this journey, whether through faith, through family, or community. And as always, I am here walking with you through this process. So thank you for tuning in today. If you or someone you love is facing breast cancer and its grief, I encourage you to reach out. You don't have to go through this alone. If you found today's episode helpful, please share it with someone who might need these words of comfort. And remember, you have permission to grieve and you have the permission to breathe. Until next time. Thank you so much for joining me today on the Permission to Breathe podcast. I hope today created space for you to breathe and find peace on your journey. I invite you to join me again next Monday for another episode as we continue to navigate this path together. Don't forget to like, subscribe, and to share the podcast. Until next time, take care and keep breathing unapologetically.